Good morning, everybody. It's an honor to join the Health Data Summit and represent patient interest in this cloudy Friday morning. I hope my small speech will wake everybody up and will produce a productive summit atmosphere that will result in digital achievements for the benefit of patients. In my everyday business life, I'm an IT professional. I do share the overall understanding that the health data availability must make a leap in Latvia. A solution, or maybe a mix of multiple ones, must be implemented. A careful planning, strategy, and goal setting must take place for best results. It is paramount that whatever it is we all build, it must be patient-centric, with high grade of interoperability and innovative force that drives the digital transformation, moving towards big data in a distributed cloud with optional extended reality maybe to provide the best precision medicine. However, I'm here to represent patient interests, nothing to do with IT. And what I have to say from that perspective is vastly different. The long and smart sentence I just read comes from the Google search, quote, health IT buzzwords, end of quote. I got some results. I randomly lined them up in a distributed cloud sentence. If somebody felt that he understood what I was talking there about, well, think again. There was no meaning whatsoever. Every year, a couple hundred lung cancer patients in Latvia get their diagnosis in the last stage of disease. It means 6 months expected lifetime. Somebody more, somebody less, average 6. There are a couple hundred working days in a year, so no big mass. Exists a huge chance that the patient is sitting, right now in a doctor's cabinet. He is introduced to the options of his existence. Based on test results about his specific cancer cells, he might have therapy available to extend his life expectancy 10 months. And as well, he might have therapy available that extends it to several years. Treatment options have had a major leap forward for Latvian patients during the last few years. A big thank you to Ministry of Health, NVD, and both university hospitals. Usually, I am most optimistic about our therapy progress. I try to stand positive in a critically demanding media culture regarding public health care, not about health data. There is zero. There's almost no data, no progress, just zero. Patients want to fight the tumor. A typical patient will want to consult multiple doctors in multiple hospitals, maybe go outside country, look in alternatives outside official health care, do all in his power to live just a few days more. A basic functionality to share his diagnosis, results, treatment in a digital form is a must. Currently, a commercial section exists, but it is insufficient for oncology patients. I started my speech with IT buzzwords and importance of planning. Those are not the things what patients want to hear. If no other way, we want simple, basic features. We want them fast. The patient who gets his diagnosis today, he has no time for strategy, no time for planning, absolutely no time for lobbying to provide state-of-the-art service. He needs tools to fight his tumor right now. Regarding the primary objective here given by the organizers, personal patient story, I will talk about my recent small experience in currently exceptionally trendy field, vaccination. This summer, my memory reminded me that I might need a tick-borne encephalitis jab this year. Finding a paper booklet with stamps and exact due dates was a bit of a challenge at home, no idea where it was. It is 5 years between the shots. So I checked e-Veselība just in case. Maybe they have the dates about my previous visit to the doctor and getting this vaccine. The corresponding section is available in the system. It seems working. It promptly displays everything COVID-related. However, nothing else. Well, no problem. Somehow I found the old booklet at home, the dates were as expected, and this autumn off I went to the hospital. I got the tick jab, did some lab tests in one go. Also, I had quite an entertainment. In the registration line, there were two very emotional older ladies, and they had a fight for the single seat available. So there's a COVID, less seats, not too many people, and they were fighting. Rah, 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 rah. Getting the jab, I had a chat with a nurse, possibly a doctor. They have a very high demand for vaccines, so everybody is doing some sort of vaccine. The chat was really nice, and I asked, will my new jab show up in e-Veselība, so next 5 years I have a decent place to check the due dates. She said no. She explained that NVD asked for 10 cents per single information piece uploaded. I was quite shocked. No fact-checking. This is just patient story, it goes as it is. We further discussed the same applies to lab tests. However, those are bought by private business and then resold back to everybody who can't keep his own record history. I was returning to the reception. I was given a leaflet to sign. There was something about personal data protection and a consent to give all my medical record to a private company present in this summit they are. I got really inspired by those emotions, those two ladies fighting. One wanted to sit on a chair, the other on a wardrobe counter, and then they exchange who has more culture and who has less. The point is that they both have quite a little. And this inspiration, it kind of came out of, no, I will not sign this document. I don't agree to give my data away to a private company. It could possibly be some sensitive medical data. No, I don't want to do that. Don't get me wrong. I'm fine with private business doing things. I do believe it is the way to do tasks way more efficient than the public sector can perform. However, today there is a lab results section in e-Veselība. It works. Well, only for COVID, but it works. The system is built on tax money. I have virtually paid for it already. The system is complicated, advanced, integrated, maybe some other buzzwords. It is also useless. And then there's a private one, not complicated at all, not to say simple. It is doing the job perfectly. The emotions patients get there, we pay twice for the same thing. A very negative emotion indeed. A problem can be spotlighted. A private business exists, and it is directly interested that the public system fails for their business to keep on. So I would call for policymakers, some present here, to do their direct job. A clear decision, a clear vision. It is perfect if public service provide health data. It is efficient if private business do so. Public and private, that's an option. Mix and match, why not? But clear boundaries must be set. Rules. True competition must be organized if private business takes part. Patients do not want to pay twice for the same thing. Well, and they want the result really fast. I drew my own recent example, a simple one with tick vaccine. But there are oncology patients every day. They move across doctors, they move across hospitals, some go abroad, and what they do, they bring heaps of papers. It is not only inconvenient, but at some point, heavy by weight. And it is year 2021 outside. Something is not perfect there. Please, make health data available. Please, do it fast. Do it user-friendly. I would call for businesses here to be bolder in lobbying whatever it is. Time is essential. Maybe less talking in this summit and more pushing your product, more signing the agreements, faster. I see children's hospital representatives in the summit. You clearly have the best results in the field, so maybe a helping hand for adults. I have strong belief that a beautiful, oh yes, a beautiful health data platform can do a decisive step towards how patients, and I mean all the people in the country, can start trusting our healthcare system in general. Currently, the trust is not perfect at all. As a result, people are going to be more patriotic about the country and the nation. Thank you.
Thank you very much to Mr. Harijs Gals. Indeed, we're going to take from your speech, I believe, very good anchoring down to most important, from speeches to actions, and what's the time schedule, time scale for this. We have also a quick question here for you. What is the patient point of view on the plan to introduce Survivor Smart Card across the EU? I cannot comment in details on this, but what's your patient view that you could have a card you're keeping around with you, and within the EU it's harmonized and working well and data are exchanged?
Well, I don't quite personally understand why somebody needs some sort of card. As far as I understand, the IT card, it's just an ID. So why you need card? You just ID yourself and there's a system and you get the data. But for Latvian patients, for that to work, we need something here first. And maybe Europe can build something for us. The patients don't care, we need a result. If it's European result, you're welcome. If it's Latvian result, you're welcome. If Americans came and give a result, why not? The patients want result.
Wonderful. The patient wants result, and tearing down also those obsolete borders maybe in the mindsets of policy makers. Thank you very much. If here would be a people in the house, then we would give you a huge applause. Thank you very much, Mr. Harijs Gals.